Welcome to lesson 1. We're looking at what is type 1 diabetes. Now throughout the course we're going to be using the board to help demonstrate some of our points. Now in advance I apologise for some of my handwriting and my illustrations. Art was never my strong point at school, but I'll do my best and hopefully it will serve its purpose to get some of our points across. Now if you feel like you have a good grasp of what type 1 diabetes is, perhaps you could skip across to the next video, but if someone asks you what is type 1 diabetes and you can't answer them, stick around. So wherever you are on your diabetes journey, hopefully someone's mentioned this word to you by now, glucose. So any form of diabetes essentially is concerned with high glucose levels in the body. Glucose levels start to rise and they go above what normal limits would be, and that's when we diagnose diabetes. There's lots of different types, but obviously we're talking about type 1 diabetes here. So how does this happen? So first, to understand this, we need to look at what happens in your body without diabetes. And it all starts with a 6-inch organ called the pancreas, which sits just here roughly in the abdomen. Now the pancreas has two different functions. One, it releases enzymes to help digest your food, and that's its biggest job. In fact, it's thought it's around 99% of its job. But it also has another job, which only accounts for 1% of its overall role, and that is to release hormones. And the hormones it releases are called insulin and glucagon. Now whenever you hear the word hormone, just think messenger. So hormones are messengers, they tell the body to do things. Now insulin's message tells the body to lower glucose levels. And it does this by telling the cells to open up to let glucose to go from the blood into the cells where it can be used for energy. Glucagon, on the other hand, has the opposite effect to insulin. It tells your body to increase its glucose levels. So it allows stored glucose to be released from the liver, the kidneys and the muscles so it can be used for energy as well. Now usually insulin and glucagon work in tandem to keep a very tight bandwidth of glucose within your bloodstream and throughout your body. So it doesn't go too high and it doesn't go too low. So one way to think of insulin is it works a bit like a key. So as you can see, the pancreas has released its insulin here, which are like little keys. We could just zoom in here just to show it so that you can see the board. So you have your keys that are released into the bloodstream, which then travel around to where they need to go. The keys arrive at the cells of the body, which are locked shut. You cannot get into these without the keys. So insulin goes into the cells, opens them up, and it allows glucose to go from the blood into the cells where it can be used for energy. So what happens in type 1 diabetes? So let me just get my pen here. So in type 1 diabetes, what happens is an autoimmune response happens. And what is an autoimmune response? Essentially, it is that the immune system gets confused. So it targets the insulin producing cells in the pancreas and says they need to be destroyed. Now we don't know why this happens. There's theories, but no one's actually yet proven it. Some people think it comes off the back of significant stress, of contracting a virus, but there seems to be no true cause of what causes type 1 diabetes. But what we do know is, once the immune system starts to destroy these insulin producing cells in the body, you no longer produce any insulin of your own. So you're not getting any keys. So as a result, you're not getting any locks opened. So the glucose, which was previously going into the cells to be used as energy, is now just sat in the blood. Now this is a problem for the body because obviously glucose is energy and the body is not getting the energy that it needs. As a result, a sequence of events starts to happen. First of all, your body tries to rid itself of the excess glucose in your blood, and it does this by making you pee it out. And of course, where glucose goes, water goes. So you start to get excess urine. Now, because you're urinating more, you start to get thirsty, which means you start to drink a lot, but everyone I speak to says it's almost an unquenchable thirst. It doesn't matter how much you drink, you feel like you're always playing catch up, and so thirst is one of the key symptoms to developing type 1 diabetes. Now obviously all that glucose you're peeing out, it's not just glucose, it's calories. So this is calories you would have previously absorbed. So what happens is your body starts to break down its fat stores to compensate for the glucose that it would have previously been using for energy. So people who are newly diagnosed with type 1 diabetes usually tell us that they've lost a significant amount of weight in the previous couple of months. Now the thing with glucose is it sits in the blood, but it's also a molecule that can go everywhere. If you think the blood vessels connect the whole body, So it's almost your transportation system. So glucose gets everywhere, which is often why people find that they get blurry vision, because glucose is now in the eyes and actually clouding up what would usually be a clear picture. Now, prior to the discovery of insulin in 1921, this was actually a death sentence. Your body would enter this cascade and sequence of events and your body would not be able to deal with it. You started to break down fat, and one of the byproducts of fat is something called ketones. Now, we'll talk more about ketones in a later lesson, but essentially what happens is your body goes from a neutral pH to an acidic pH, which is bad times for the body. So the body starts to become more and more acidic, you become more and more unwell, and you tip into something called diabetic ketoacidosis, which basically just means diabetic, which is high glucose levels, keto, which is a byproduct of fat breakdown where you produce ketones, and acidosis, your body turns acidic, and this condition was fatal. Now, in modern medicine, it's very rarely fatal nowadays, as we're able to catch it early and actually treat with insulin. But it's a very serious condition, and some of you watching may have actually gone into DKA, as we call it, diabetic ketoacidosis, upon diagnosis, and perhaps you've even experienced it since then as well. It's not the nicest thing, and people usually become very acutely unwell with it. So obviously, we no longer have any insulin production ability of your own. So we need to supplement this with insulin administration, which is why people with type 1 diabetes have to go on insulin. And over the years, insulin has progressed. People who were diagnosed way back in the day, the 20s, the 30s, the 40s, the 50s, etc., were drawing out of a vial big needles, and they had very limited options with their insulin choices. Nowadays, we have a much broader scope of insulins that we can use. We have long-acting insulins, rapid-acting insulins, mixed insulins, intermediate-acting insulins, and lots of other different types. So we're getting more and more close to matching how the body releases insulin, but we're still not quite there. So you'll never quite achieve 100% glucose time in target every day, because it's just almost impossible. So essentially what you're doing is you're acting as a human pancreas. All those jobs that the pancreas would normally do, you're having to think about the insulin side of things. One of the good things about type 1 diabetes is that although it's a condition that probably no one wants in reality, you can still live a full and healthy life with it. So it doesn't stop you doing anything, you just need the tools in order to know how to deal with certain situations, which we're going to teach you on this course. So that's what type 1 diabetes is. I hope you found that useful, and we'll leave it there, and I'll see you in the next lesson.